Hi there, Dr. Peterson here with Regions EMS for today's daily COVID update. Today is Thursday, April 16th, 2020. Say it with me. The information presented today is current as of today, and we make no guarantees it'll be current tomorrow. Just check into our website at regionsems.com and click on the COVID link for a page full of resources and up-to-date information that we have reviewed and compiled for you. Thanks to those of you that submitted patches for our patch board. The patch board is live on our site as well. Click on the COVID page and you'll see a link at the top for that. Let's get into some statistics. So as of this morning, just over 2 million cases confirmed worldwide, with just over 139,000 deaths reported related to COVID. Here in the U.S., we're just about a third of those cases, so just over 629,000 confirmed cases. Again, a very gross underestimate just because of testing availability. And in the U.S., we've seen just over 26,000 deaths related to COVID-19. In Minnesota, we're just over 1,800 confirmed cases with 87 deaths as of yesterday evening. And in Wisconsin, kind of tracking just about double Minnesota, so 3,700 cases and about 180 reported deaths. As you can see on the graphs that were displayed, the curves are growing linearly rather than exponentially. So this may be what we see. We may just see this kind of gradual, several cases a day kind of thing, and we may not see a huge spike. Or we may reopen the state, the economy, the country, and get people back together and then suddenly see a spike. We don't know. We don't know what's going to happen. I feel like we're prepared. I feel like hopefully you feel the same way. But we just have to wait and see. We have to stay vigilant. We have to take the adequate precautions, use common sense, and stay vigilant. Couple announcements for today. MRCC would like you to start using the color-coded triage report method. There's a reference guide posted on our COVID page, but all they need is age, gender, destination hospital, ETA, chief complaint, and a triage color. You do not need to give a full report on the patient. We just need a brief one-liner summary, and they'll pass that on to the receiving hospital. So let's try to keep the MRCC reports short. I have heard the colors coming out, so I know that the information is out there, but I think we just have a little bit of work to do to get those MRCC reports shortened a little bit just to preserve the airwaves. Along with that, also just remember that we have authorized that you do not need to call in routine non-transport reports. If you feel it's high risk, if it's an infant, if it's someone who's altered in any way, or you have concerns about the safety of the patient, please call in. We can get a doc on the line to help you out. But for routine non-transports, you do not need to call MRCC to call in a report for those. Just keep that in mind. All right, I don't have too much else today. Just like to talk about the spread of COVID-19. We're not seeing a whole lot of spread within the healthcare community. I'm aware of one case for sure in one of our partner agencies, and that was related to travel outside of work. I have not heard of any transmissions from patient to provider or provider to provider within any of our affiliated agencies. If I'm incorrect, please correct me on that, but to my knowledge, I am not aware of any work-related transmissions of the COVID-19, which means that the PPE is working. I've said this before, and I will keep saying it. It is critically important to wear PPE on every call. We don't know who's infected. We don't know who's not infected, so just play it safe. That also extends to in the station, in your quarters. We really, really, really need to be wearing masks and practicing social distancing. Even when no one's watching, it's inconvenient. It makes for a long shift sometimes, but it's critically important. If you look at our exposure risk management document, so what happens if your coworker goes home sick with COVID symptoms, it could be anything from nothing happens to you to you're off work for 14 days in quarantine. And the biggest difference that we can make is by wearing masks all the time, even in the station. If anyone is wearing a mask, if the person who gets sick is wearing a mask, then your exposure risk, the highest it would be is medium, which means you're not off work. If you're wearing a mask, same thing. The exposure risk, the highest it would be is medium. If nobody's wearing a mask and someone goes home sick with symptoms suddenly, then everyone else working that day would be considered a high-risk exposure and would be taken off of frontline patient-facing care for up to 2 weeks potentially. So again, can't emphasize that enough. Do it for everyone, do it for our workforce, do it for your families. That's the best way that we can protect ourselves and protect each other, is by wearing a face mask and practicing social distancing even at work. Again, there's lots of resources on our website. I've also posted some additional documents. One is from FEMA, some guidance on dealing with patients and family members in distress because of COVID-19, and just some kind of psychological techniques you can use to help calm them down, as well as some other PPE resources. So check it out. And also then please, if you don't see your agency on our patch board, please submit your logo, your patch, just a little comment about who you are, where you're from. And also, I think maybe fun just to submit some stories about what you're doing to get through this quarantine. At work, at home, whatever. How are you making the time pass and entertaining yourself? Come up with any new games, any activities at the station that you can do while isolating. There's a form on the website, or you can email to regionsems@healthpartners.com. Again, your agency, where you're from, your patch, and also just a story or two about what you're doing to get through this COVID-19 quarantine. We're here. Ask any questions. regionsems@healthpartners.com. We'll get back to you as soon as we can. But otherwise, know that we're working for you. We're advocating. Our current project is trying to make sure there's a good framework for reporting positive results back to the EMS agency if a patient is tested at the hospital. And we've made some progress on that, but we're still working hard on that. So we are working for you. Thank you for all that you're doing. Thank you for showing up for work every day, for facing the patients, for doing the right thing, for providing good care. Stay smart, stay safe, stay healthy, and we'll see you next week.